This is an abortion rights demonstration in 1972. People marched to demand the right to legal abortions. And the next year, the Supreme Court case Roe v. Wade granted them that right. But fast forward to almost 50 years, and protests for abortion rights are still happening. A lot of the fight over abortion policy centers on restrictive laws set by state governments and the courts that uphold or strike down those laws, including the Supreme Court. But the president and Congress hold a unique power over abortion access because they have the final say on the federal dollars that support it. In every federal budget for the past 43 years, among all the programs the government funds, like the military, foreign aid, and education, there's also language about something the government can't spend federal money on: coverage of abortion, except in the case of rape or incest, or if the pregnancy would place the woman in danger of death. This provision is called the Hyde Amendment, and it disproportionately affects low-income people who rely on federally funded health care. Every president since 1976 has supported the Hyde Amendment by approving an annual federal budget from Congress that's included it. But the 2020 election could change this, because while one candidate supports the Hyde Amendment, the other has vowed to oppose it. The Hyde Amendment's induction into the federal budget can be traced back to Roe v. Wade.
It's such a weird concept because, people still talk about federal funds being appropriated to Planned Parenthood nonstop, even though the Hyde Amendment stops it from happening unless, or stops it from being used for abortion. It's such a dumb fucking conversation.
Pervert.
This is why I wish Democrats were like Republicans in the way that they just got away with their agenda. It's such an easy clap for the Dems to do this. It's such an easy clap to just push this forward.
This is a deranged pervert.
In the years immediately following this decision, the federal government paid for abortions through Medicaid, which accounted for roughly a third of all abortion procedures. But the anti-abortion backlash was swift, including in Congress. In 1976, Illinois Representative Henry Hyde proposed the abortion-restricting Hyde Amendment during an annual budget hearing. It passed with 199 to 165 vote, ending up in that year's spending bill where it has stayed ever since, voted for by anti-abortion politicians and pro-abortion rights politicians. In every case, these budgets have been approved and signed by the sitting president. In 1977,
but withholding tax money is not the same as making abortion illegal. If most of the country opposes abortion, maybe we shouldn't support it with tax money, but it should still be legal. You're wrong. Most of the country doesn't fucking oppose abortion. Actually, the overwhelming majority of the country literally thinks abortion should be legal and accessible. 75% believe that Roe v. Wade is the law of the land, so you're completely incorrect. And secondly, on top of that, you don't get to pick and choose what kind of health care gets paid for. That is completely psychotic. Okay, it's like making an argument that, diabetes medication should not be offered to people if they don't have a genetic predisposition to diabetes and if they got it because they ate poorly. You don't get to make that choice. It's completely psychotic. By the way, for the record, I don't believe that. I just want to let you know so that people don't misunderstand me. And some people would probably make that argument. Those people are psychos, and you should treat them as such.
His name
Henry
is
Hyde made the
Hasan.
intentions of his amendment clear. He said, "I certainly would like to prevent, if I could legally, anybody having an abortion, a rich woman, a middle-class woman, or a poor woman. Unfortunately, the only vehicle available is the Medicaid bill." There's a handful of agencies directly affected by the Hyde Amendment that provide health care through federal funding, like the Indian Health Service and the Peace Corps. But Medicaid is the biggest. It pays for basic health services for just over 76 million people in the U.S. who live near the poverty line or are disabled. Part of Medicaid's funding comes from federal dollars. The other part comes from the state you live in.
Abortion care in the United States is largely driven by where you live, both in terms of the availability of services and, in addition to that, the ability of insurance to pay for it.
These 16 states will help Medicaid users cover the cost of abortion. But these 34 states and Washington, D.C. won't. Anyone seeking an abortion there has to pay the full bill. That means nearly 8 million people of childbearing age who live in these states aren't covered for abortion services because of the Hyde Amendment. These Medicaid restrictions place the biggest burden on low-income people.
We could basically quit doing the work we do if the Hyde Amendment didn't exist.
Lori Roberts manages an abortion fund in Alabama, one of the most restrictive states when it comes to abortion access.
An abortion fund is an organization that helps people access abortion care. It can be anything that removes the barriers to getting to and from the clinic. And then there's just direct financial support for the abortion procedure.
Orson camera angle. Pokalaw's camera angle.
Sure.
The price of an abortion in the first 10 weeks of pregnancy without coverage is roughly $500, and it gets more expensive in later weeks of pregnancy. That's a lot of money for someone who qualifies for Medicaid. To be eligible, you generally have to make less than 138% of the federal poverty line. For a single person, that's less than an $18,000 annual income. For a family of two, it's $24,000. And for a family of three, it's about $30,000. Because of racial disparities in our country, Medicaid recipients are more likely to be Black or Hispanic.
I can personally say what it was like for me, right? I went to the clinic, I went for my first appointment, I scheduled my procedure.
But we do limit procedures. Elective or cosmetic procedures are not covered by medical. Hey, you notice how you substituted a life-saving reproductive health care with an elective or cosmetic procedure? Why do you think you had to do that? Do you consider abortion to be elective or cosmetic? Abortions are, in every sense of the word, the regular, normal kind of, in a lot of instances, life-saving procedures that should absolutely be a part of regular coverage. Just like cosmetic surgeries can also be life-saving or life-improving, like if you have a third-degree burn, for example. Dental isn't covered as well. Okay, stop using a shitty system to justify making that system even shittier. Yeah, dental should be covered. Just because it's not doesn't change the reality that it also should be covered. It's kind of weird.
Procedure. I wanted to have a procedure and I couldn't. I didn't have the money in time. That doesn't mean that I don't love my child. It doesn't mean any of those things. But what it means is that I went through a lot of emotional and physical trauma because what should have been a decision that was only mine was taken away from me.
A study of 269 women from 2015 to 2017 in Louisiana, a state that doesn't cover abortion through Medicaid, shows that 29% of women would have had an abortion had Medicaid covered it, which is the intended effect for anti-abortion advocates. Fewer people having abortions. Abortion restrictions like the Hyde Amendment have made their way into other types of health insurance coverage, too. In 2010, Congress didn't pass the Affordable Care Act until it included language saying marketplace plans don't have to cover abortion. Today, these states won't cover it under marketplace plans. And these states even restrict private insurance companies from covering the procedure.
And so that more and more people are affected, and they may not even know that they've been affected until they seek abortion care.
But it's the Medicaid restrictions, both federal and state, that specifically target poor people.
Abortion is like many other services. If you have means, you can either have insurance that pays for a service, or you can afford to pay for these services out of pocket. And if it's not offered in a place that's close to you, you can afford to either travel, get lodging, take time off of work, get childcare. All of those things are things that are available to higher income women that may not be available to lower income women.
The two candidates in the 2020 election are solidly in their partisan corners on the issue of abortion access. But that wasn't always the case. Joe Biden took office in the Senate in 1973, the same year Roe v. Wade passed. And he's supported the Hyde Amendment since it entered the federal spending bill in 1976. But in 2020, this is the landscape. The state you live in and how much money you have are the biggest factors in whether someone can access an abortion, which is why Joe Biden, as a presidential candidate, says he's changed his stance.
If I believe health care is a right, as I do, I can no longer support an amendment that makes that right dependent on someone's zip code.
And Trump has only dug deeper in his anti-abortion position.
I notified Congress that I would veto any legislation that weakens pro-life policies or that encourages the destruction of human life.
It's also why the stakes for abortion.
Here's my hot take is that I think it is so deeply embedded in American. It's so deeply embedded in like American thought to not use federal funds for things that you don't like, even though it happens all the time. That abortion restriction is abortion restriction in this way is like a pretty smart way to restrict access to abortion. Because it's going to be an argument where people are pro-lifers are going to unironically be like, well, I don't want my federal tax dollars to go to aborting babies. And I feel like that's going to stick with a lot of people who have a hard time being like, fuck off. That's not how this works. Like, it's healthcare. You can't just restrict a certain part of healthcare just because you don't like it.
Abortion policy for the 2020 election are clear. It's a choice between a president who plans to lift this barrier to abortion access for the country's most vulnerable people and one who will keep the status quo at their expense.
Why can't you have Medicaid and then go to a state where it's covered and get it, Fivehead? I actually don't know how that works, but if you're on Medicaid, you probably can't go to another state that easily. If you're on Medicaid, if you can get your abortion covered, you're really fucking poor.
Thanks.
Killing babies isn't healthcare, my guy. What the fuck? Brother, wait till you hear my takes on euthanasia. You can't, they choose your doctors. It always shocks me how pro-lifers use the literal worst ways to protest and actual methods to lower abortion rates. I don't really understand how the whole abortion is bad stance. I really want to know where that ideology came from and who started that shit. I mean, it's just Christianity, isn't it? That's where it comes from. I feel like having a child is much more of destroying human life than not having the child. Can't use Medicaid out of state. Next, you'll say gender reaffirming surgery should be free. Gender confirmation? Yes. Yeah. Also, life-saving medical treatment. 100%. All medical procedures should be free, with like maybe a few exceptions. In many cases, the resident, if you move in declaration paperwork takes time, you can be forced to wait up to a year for residency to be updated at all levels. How does abortion access work in countries that aren't like majority Christian? I'm super curious if it's just a Christianity thing or is it religious in general. You can have abortions in Turkey. That ass spent 2 hours doing a project on euthanasia to find out it's supposed to be on euthanasia. Summer, where you at? You're joking, right? No way you support euthanasia? Why wouldn't I support euthanasia? I think it's the most ethical, moral thing you can do if someone, especially if someone has like a crippling disease, if someone doesn't want to go through the process of like having dementia or Alzheimer's, like late stage Alzheimer's, or if someone is in a tremendous amount of pain from cancer and they want to die, they absolutely should be able to after they get the proper psychiatric assessment. What? I know you might ban me for my opinion, but if you can't afford to have a child, then don't have unprotected sex. I'm not gonna ban you for your opinion. It's just stupid. I think that Christians and their beliefs are a real detriment to our country. Life is already fucking shitty as it is, dude. You're really gonna fucking want to punish people for doing something that makes them feel good and feel connected to one another? Fuck you, idiot. Bro, don't ban me for my opinion, but if you're able to drown, maybe don't go swimming. True. Imagine using economic reasoning to hate on sex and abortion. Who is carrying out euthanasia? Doctors don't want to kill. What do you mean? You can have a doctor administer I mean, you have DNR for a reason. Doctors fucking technically do passive euthanasia, voluntary passive euthanasia. If you have sex with a condom, you can't get pregnant. Yeah. You could. It's a lot harder, but you still could. You might ban me for my opinion, but if you have sex, you're a fucking simp. I agree. Before you flip out on me, I'm completely pro-choice. But pro-choice arguments gloss over personhood. Until we can unequivocally establish that, how can we reasonably establish grounds for abortion? In ancient history, families would be obligated to kill their own baby because they couldn't take care of it. Nowadays, different discussion because of gender selection. What? I mean, just because we can't establish what personhood is, just because we can't have a reasonable understanding of what personhood is, if we were to stop something that literally harms people across the board, because restricting access to abortion doesn't necessarily limit the number of abortions that take place. It just makes abortions unsafe. There are numerous studies conducted on this. So just because we can't have a philosophical foundation for personhood, something that like literally no one agrees on, if we were to do policy that way, we would just be running around and limiting abortions without limiting abortions and actually harming people that way. Thank God we don't do that.